Did you know that doctors can often spot serious health problems just by noticing small hygiene mistakes in older patients? These simple habits, which may seem harmless, could actually be signs of dangerous issues developing in your body right now. What's truly scary is that many older adults don't even realize they're making these critical mistakes every day. In the next few minutes, I'll share with you the 7 hygiene mistakes that doctors instantly recognize in seniors and how fixing them could save your life or the life of someone you care about. This information isn't something you'll find in schools or hear about in most doctors' visits, and it's rarely mentioned in health magazines. But it could make all the difference in whether you enjoy your golden years in good health or face preventable conditions that take away your independence and dignity. Let me introduce you to Harold, a 75-year-old retired engineer who believed his personal care routine was just fine. He stayed active, enjoyed playing golf twice a week, and never missed a chance to cheer on his grandchildren at their baseball games. But during what he thought was just a routine checkup, his doctor immediately noticed 3 serious hygiene mistakes that had been silently revealing a dangerous condition building up in Harold's body for months, something he had no idea about. "I had no clue," Harold told me afterward. "I thought I was doing everything right. If my doctor hadn't spotted these small hygiene issues, I might not be here today." Today, I'll share what those mistakes were, so you can avoid the same frightening experience. But, even more importantly, I'll tell you what simple changes you can start making right now to help add more healthy years to your life. Mistake 1. Ignoring your oral hygiene. When was the last time you took a close look at your toothbrush? Is it worn out and frayed? Are you brushing thoroughly twice a day? And here's a more important question. Did you know that poor dental care isn't just about bad breath or losing teeth? It's actually linked to serious health problems like heart disease, stroke, and even dementia. Experts at Harvard Medical School have found that bacteria from untreated gum disease can enter your bloodstream, leading to life-threatening heart conditions. In fact, their research shows that seniors with poor oral hygiene are 3 times more likely to develop heart issues than those who take proper care of their teeth. But don't just take my word for it. Let me tell you about Sylvia, a 68-year-old retired teacher from Oregon. Sylvia ignored her bleeding gums for months, thinking it was just a normal part of getting older. "I thought it was just something that happens when you age," she told me. But during a routine checkup, her cardiologist found dangerous inflammation in her heart valves caused by oral bacteria traveling through her bloodstream. The doctor told her that if she'd waited just a few more months, the damage might have been irreversible. What should you do right now? First, take a look at your toothbrush. If it's more than 3 months old or showing signs of wear, replace it right away. Ideally, switch to an electric toothbrush. It removes 62% more plaque than manual brushing, according to studies from the University of Pennsylvania Dental School. Make sure to brush twice a day for a full 2 minutes each time. Set a timer if you need help. Floss every night without fail, and don't skip your dental checkups, even if you wear dentures. Have you noticed any bleeding while brushing, or swelling in your gums? These aren't just normal signs of aging. They're warning signs that your body is trying to tell you something. Don't ignore them for another day. Mistake 2. Infrequent bathing and skin care. How often are you taking a bath or shower? Be honest with yourself. Many older adults start bathing less frequently as they age. But did you know your skin is your largest organ? Changes in your skin can reveal serious internal issues before other symptoms show up. Dermatologists from the Mayo Clinic have warned that bathing less often in seniors can hide early signs of diabetes, liver problems, and heart issues. Their studies show that nearly 40% of undiagnosed health problems in older adults could have been caught earlier through better skin care. Take Clarence's story, for example. He's a 77-year-old retired postal worker from Michigan who thought bathing just once a week was enough, especially during the winter when his skin felt dry. "I didn't want to dry out my skin," he said. But during a routine appointment, his doctor noticed unusual skin discoloration, which led to further tests revealing early-stage kidney disease. The discoloration wasn't from poor hygiene. It was from infrequent bathing, which had hidden a critical symptom that could have been noticed much earlier. What's the solution? Create a regular bathing routine, at least 3 times a week, even if you're not feeling particularly active. Use mild, fragrance-free soap that won't dry out your skin. After your bath or shower, apply a moisturizer while your skin is still slightly damp to lock in that moisture. And, just as important, make it a habit to regularly check your skin for any unusual changes in color, texture, or sensation. Are you seeing dry, flaky patches, strange discoloration, or areas that itch constantly? These could be your body's way of telling you something more serious is going on inside. Don't wait another day to take action. Mistake 3. Neglecting nail care. Take a moment right now to look at your fingernails and toenails. What do you notice? Are they neatly trimmed, clean underneath, and free from discoloration? The condition of your nails is a clear sign of your overall health, and doctors check them right away when evaluating older patients. According to the American Academy of Dermatology, changes in your nails can indicate more than 20 different health problems, from anemia to thyroid issues to heart disease. Their research shows that in patients over 65, nail abnormalities helped diagnose previously undetected internal conditions in nearly 30% of cases. Let me tell you about Beatrice. At 82, Beatrice didn't think her thickening, yellowing toenails were anything to worry about. She just stopped wearing sandals and hid them in shoes. "I thought it was just part of getting older," she said. But when she finally visited a podiatrist for foot pain, the doctor quickly diagnosed a fungal infection that had been allowed to grow for so long it revealed her severely weakened immune system. Further tests found a serious underlying health issue that needed immediate attention. What should you do today? Trim your nails regularly, straight across with slightly rounded edges to prevent ingrown nails. Keep them clean and dry, wear breathable shoes, and change your socks daily. And never ignore any changes in the color, texture, or thickness of your nails. These aren't just cosmetic concerns. They could be warning signs from your body. Are your nails brittle, discolored, or thickened? These changes aren't inevitable with age. They're your body signaling that something important is going on. Will you listen before it's too late? Mistake 4. Improper incontinence management. This might be the most surprising hygiene mistake because it's so common, yet so many people try to hide it. More than 50% of seniors are silently dealing with some form of incontinence, but the real shocker is how many try to conceal it instead of seeking proper treatment. Urologists at Johns Hopkins Medicine warn that untreated incontinence can lead to painful skin infections, increased risk of falls, social isolation, and even mask serious conditions like bladder or prostate cancer. Their studies show that seniors who properly manage incontinence have 60% fewer complications than those who try to hide the issue. Let me tell you about Douglas, a 73-year-old retired accountant from Arizona. He was too embarrassed to mention his occasional leakage to his doctor. Instead, he used paper towels and changed his clothes often, thinking he was managing things. But when he finally sought help after developing painful sores, doctors discovered an advanced prostate issue that could have been treated months earlier with much better results. My pride almost cost me my life, Douglas admitted. I wish I'd talked to my doctor at the first sign of trouble instead of trying to hide it. What should you do? If you're dealing with any form of incontinence, remember this. Never be embarrassed to discuss bladder issues with your doctor. They deal with this every single day. Use absorbent products designed specifically for incontinence instead of makeshift solutions. Change promptly when wet, and follow a proper cleansing routine to prevent skin breakdown. And most importantly, understand that incontinence is not a normal part of aging. It's often a sign that something needs medical attention. Are you dealing with occasional leakage, planning outings around bathroom locations, or using makeshift protection? Don't wait another day to talk to your doctor. Your health, and potentially your life, depends on it. Mistake 5. Ear hygiene errors. What's your ear cleaning routine? Be honest. Are you using cotton swabs and inserting them deep into your ear canal? If so, you're making a risky mistake that many seniors make every day. A lot of older adults are damaging their hearing and missing signs of serious infections because of improper ear cleaning. Otolaryngologists warn that improper ear cleaning causes nearly 40% of ear canal injuries in patients over 65, and many of these lead to infections that could have been easily avoided. Let me share Patricia's story. At 71, Patricia, a retired librarian from Washington, regularly used cotton swabs to clean deep inside her ears until she accidentally punctured her eardrum, causing a severe infection that spread to nearby tissue. I'd always cleaned my ears this way, she explained. No one ever told me it was dangerous. Patricia ended up needing emergency treatment and suffered permanent hearing loss that could have been completely avoided. What's the correct approach to ear hygiene? Here's a simple rule to remember. Never insert anything smaller than your elbow into your ear canal. Only clean the outer ear with a warm, damp washcloth. If you feel you have excess wax, use ear drops specifically designed to soften the wax and follow the package instructions carefully. And if you experience any pain, discharge, or hearing changes, see a doctor immediately. Are your ears itching, feeling full or blocked, or experiencing unexplained hearing changes? Don't try to handle these issues on your own. They need professional attention. Your hearing is precious. Take care of it properly. Mistake 6. Poor foot hygiene. When was the last time you gave your feet a thorough inspection? Not just a quick glance, but a careful look at every part. Between the toes, the heels, and the soles. Your feet can reveal important clues about your circulatory and nervous systems, which doctors check closely in elderly patients. Podiatrists from the American Podiatric Medical Association emphasize that foot hygiene issues often signal early signs of diabetes, neuropathy, and vascular disease. Studies show that in patients over 65, proper foot care and regular inspections could prevent up to 85% of diabetes-related amputations. That's right. 85% of amputations could be avoided with proper foot care. Let me tell you about Raymond, a 76-year-old retired factory worker from Illinois. Raymond ignored the dryness and small cuts on his feet, thinking they were just part of getting older. "My feet had been rough for years," he admitted. But when his doctor noticed them during a routine exam, he immediately ordered diabetes testing, catching the disease in its early stages when lifestyle changes could still make a big difference. "If my doctor hadn't checked my feet, I might have gone years without knowing I had diabetes," Raymond told me. "By then, the damage would have been much worse." What should you do starting today? Wash and thoroughly dry your feet daily, especially between the toes, where fungi love to thrive. Inspect your feet regularly for cuts, sores, or changes in color or temperature. Always wear clean, dry socks made from natural fibers or moisture-wicking materials. Apply moisturizer to dry areas, but never between the toes. Never ignore pain, numbness, or wounds that aren't healing. If you notice dry, cracked feet, cuts that won't heal, or unusual discoloration or loss of feeling, don't delay. These aren't just cosmetic issues, but potential early warning signs of serious conditions that require immediate medical attention. Mistake 7. Medication-related hygiene issues. Are you on multiple medications? Have you noticed any changes in your body odor, sweating patterns, or mouth dryness since you started them? The medications keeping you alive might be causing hygiene issues that could signal dangerous side effects. Pharmacologists at the American Geriatric Society have documented how certain medications can lead to dry mouth, excessive sweating, or changes in body odor, early signs of potential toxicity. Research shows that nearly 40% of adverse drug reactions in seniors first manifest as changes in personal hygiene before progressing to more serious health concerns. Let me tell you about Barbara, a 67-year-old retired nurse from Florida. Barbara's unusual body odor was initially dismissed by her family as a hygiene issue, but her geriatrician recognized it as a sign of medication toxicity slowly damaging her liver. "I was showering regularly and using deodorant," Barbara explained. "I had no idea the smell was coming from inside my body, not from a lack of cleanliness." What can you do to protect yourself? Track all hygiene changes after starting new medications. Keep a simple journal noting any differences in body odor, sweating, mouth dryness, or skin changes. Stay hydrated unless your doctor advises otherwise. Report unusual sweating or odor changes to your doctor immediately, as these could indicate dangerous drug interactions. And never adjust dosages without medical supervision, even if you suspect the medication is causing hygiene issues. Have you noticed unusual body odor despite regular bathing, excessive sweating, or extreme mouth dryness? Don't assume these changes are just part of aging. They could be warning signs of life-threatening medication effects that need immediate attention. Now, you know the 7 critical hygiene mistakes doctors immediately notice in elderly patients and exactly how to correct them. By addressing these issues today, you can prevent serious health problems, maintain your dignity and independence, and potentially add years to your life. Remember, proper hygiene isn't just about appearance or social courtesy. It's a vital part of maintaining your health as you age, and these simple changes could literally save your life. If you found this information valuable, please hit the like button right now. Has your doctor ever noticed any of these hygiene issues during your visits? Share your experience in the comments below. Don't forget to subscribe and hit the notification bell to receive more potentially life-saving health information like this. And please share this video with your loved ones over 60. This knowledge could literally save their lives.